Hi there. Happy Monday. So today is we're continuing this series on speaking about supplements and how to be smart when you take your supplements. And today's topic is how to take supplements, and there are several elements to that. First of all, let me just introduce myself. I'm Dr. Shiroko Sokitch, owner of Heart to Heart Medical Center and the author of the book Healing When It Seems Impossible: 7 Keys to Defy the Odds. And I am an expert in helping people who have long-term chronic undiagnosed conditions find solutions to their health. So, and supplement taking is a part of what a lot of people do. So, today I want to tell you about how to take them. So, there's several elements to how to take supplements. One is which ones, when do you take them, and how do you decide if they're doing anything for you. So, and I'll just move right along. So, first of all, which supplements? So, any sort of like nutritional supplements that are sort of your daily maintenance. And I recommend that people take some kind of a multivitamin as a minimum. And I have, of course, a high quality multivitamin available if you need to know one. And there are many different kinds of multivitamins that have different qualities. So, in general, I look for uh, either a high grade organic food based multivitamin that is better for some people. They contain lower doses, but they're made from food, so they're the most like food. So if you're going to take a multi that you want it to be high quality food based, there are several companies that do that. And then there are sort of more medically based, made in a lab, chemical lab, and they're more specifically targeted for those particular nutrients. And I always look for really clean with no added ingredients. Anyway, if you take a multivitamin, the sort of daily recommendations I have for supplements is a multivitamin and omegas. I think everybody should take a high quality omega that is either vegan or fish based, but to make sure again that it's been tested for heavy metals and doesn't have, radiation and all of that stuff. So, and when you take those sorts of supplements, they should be taken with food because they're basically a part of your daily food if you think about it. And so, a multivitamin and omegas and some other sort of vitamins, like if you take iron or calcium or magnesium, things like that, you would take those with food. Hormones or hormone support supplements such as like DHEA or pregnenolone, or there are other like ashwagandha or holy basil. Those are herbs that support your hormones. They should be taken sort of away from food if possible. And depending on where you need them, you would take them in the morning most likely because they're designed to give you energy and to help support your daily energy. You would take them maybe a half hour before food. I try to make things easy about how to take supplements and when to take them. So I try to make it a little bit easy so you're not taking, supplements 5 times a day because we're all busy and we all want to, sort of maximize our time not taking pills or supplements. So, if you like take thyroid medication or some other medications that you have to take first thing in the morning, you can take your other hormonal supplements like DHEA or pregnenolone or ashwagandha. You can take all those things together, and you can take them about a half hour before food, uh, and then you can have your food in the morning, and then the next category of supplements is herbs that are designed to like help support one of your systems. So they're more medicinal and they're designed to help support, let's say, your digestion or to kill bacteria or something like that. And if you're taking that kind of supplement, what you want to do is you want to take it usually away from food as well, but maybe, like if you have to take it away from food, you can again take it in the morning with your other things. And then usually you have to take those twice a day. So you would take that also in the evening, maybe a half hour before dinner or something like that. Then there are digestive support supplements like enzymes and hydrochloric acid and things that help your digestion work better. Sometimes things that would kill bacteria like H. pylori in your stomach. If you're taking those sorts of things, you would take them with a meal. Like digestive enzymes, you would take an enzyme, and unfortunately, that's not one you can take just twice a day or once a day. You have to take it with the meals. If you don't have a big breakfast, then maybe you don't have to have it with your breakfast, but usually you'd have to have it with your lunch and your dinner. Because if you can't digest your food without the help of enzymes, then you would need to take it with your enzymes. And then the next category of supplements would be those that are medicinal for some other reason. So sometimes those are like glutathione or things that help support your blood pressure or things that help support various health conditions like CoQ10 or glutathione or things like that. And those can be taken with food. So you can decide which meal you want to take them at. Sometimes people take everything at breakfast. Sometimes they take it all at lunch or all at dinner. The only caveat with taking those kinds of supplements at dinner is that sometimes they can activate your system and they might make it harder to sleep. So that in which case you wouldn't want to take them in the evening. You'd want to take them either at breakfast or at lunch. And then the last category that I would speak about is the things that you take at bedtime, the things that help your sleep and that help support your sleep. Like if you take progesterone, progesterone helps sleep. It's not really a supplement, it's more of a medication, but it is really good for sleep. And it also helps support all the other things that it is designed to do, like perimenopausal symptoms, mood, fatigue, things like that. But you would take progesterone at bedtime. And then the other things that you would take at bedtime are things like magnesium, because magnesium helps relax your muscles. There's a supplement that helps lower cortisol, and cortisol is one of the main reasons that people have trouble falling asleep at night or sleeping at night. And there's a supplement called phosphatidylserine, and that is particularly excellent for helping lower your cortisol. It takes about a week to kick in, but if you have issues with sleeping or you feel anxious at night, phosphatidylserine will help lower that cortisol and help you sleep better. And some people who are having belly weight, belly fat, cortisol, lowering your cortisol will also help that. In general, I tell people to take most of their medications for supporting their hormones like estrogen, testosterone, progesterone at bedtime, because, well, it depends on when you shower, because a lot of those come as creams and you put them on after you shower. And I tend to shower at night. So, and I recommend showering at night because it helps you kind of get rid of the day and go to bed fresh and sort of reset your whole system. So just a little tip from my years of doing my job and feeling like I need to clear my system at the end of the day rather than in the morning before I start. So one more thing about taking supplements is you want to pay attention to how you feel when you take them. So one, if you're going to add new supplements, I always recommend that you start with just one, not 5. You start with one supplement and then feel that for a couple of days to make sure, one, you don't have negative side effects, and 2, that it's doing what it's meant to do. You may not feel it right away in terms of what it's meant to do, but if you take it by itself, you'll have the ability to notice what's going on. Then you add the second one a couple of days later. So let's say you go to somebody like me and I gave you like 4 supplements. You would start with one, take it for a few days, then add the other, take it for a few days, and then slowly get them all going. And if you're seeing me, I always advise you how to do that and give you the guidelines to make sure that you do it right. So that's one. Two, when you take supplements, if it's a new supplement for you, you want to see how it works, right? Because we don't want to take things that aren't working for us. We want to make sure that they're helpful and an addition to our lives rather than something that isn't an addition. So sometimes you can tell right away, but sometimes you can't tell right away. So I always say try the supplement for a month and see how you feel. And if there's no difference at all in how you're feeling, then stop it. If after you stop it, you start to feel whatever symptom it was designed to help you with again, then you know that maybe there was a subtle in the background effectiveness of that supplement. And so you can go back on it. If you notice no difference being on it or off it, then just don't take it because you're wasting your money if you're not feeling anything. Now, there are some things it's hard to tell a difference, right? But things like fatigue and digestive issues, things like that, if you have those symptoms and then you take something to help relieve those symptoms, it should work. It should be effective. If it isn't working, then you should move on to something else or have a conversation with your care provider about it. So supplements are really, in some ways, they're also medicine. You know, they're maybe different than medications. They may have less side effects, or they may do something different on a more holistic level, but they are still designed to achieve a purpose. And so you want to make sure that the supplements that you take, one, are really good quality and don't have a lot of added ingredients, as I've mentioned before, and two, that they work for you so that whatever it is that you started taking them for, you start to feel better in the way that you want to be feeling better. Okay, I hope you found that helpful, and I look forward to seeing you again in a couple weeks. Thank you so much. Have a great day.